Yeah, so my name is Okoli, and I'm currently serving as the president of the American Psychiatric Nurses Association. I'm also a professor at the University of Kentucky College of Nursing. I'm a psychiatric nurse practitioner, and I see patients currently. And I do a lot of research in health policy and different aspects of enhancing the health of people living with mental and behavioral health challenges. So currently, when we look at some statistics that have been provided by the Substance Use Administration, SAMHSA, they mentioned that at least 1 in 5 adult Americans are living with a mental or behavioral health challenge. That's 73.8 million Americans. And a lot of these individuals, more than 1 in 3, that's almost 26 million of them, go untreated each year. There are so many challenges that come along with going untreated. Issues related to being able to have insurance. And often, even if there is insurance, there are high out-of-pocket costs. So all of these present some challenges for people to access the care that they really need. So first, thank you for that question, because it's important for people to actually understand who we are and then what we do as psychiatric mental health nurses. So psychiatric mental health nurses are trained specialists in delivering psychiatric mental health care to individuals. We do a full range of services. Advanced practice psychiatric nurses can prescribe medication and provide other treatment modalities to help people to address some of their mental health challenges. And psychiatric mental health nurses can be found in so many different settings. We're in hospital settings, we're in the community settings, and we work in these settings collaboratively with other mental health providers in order to be able to provide a full range of psychiatric services. So currently in the nation, we are pretty strong. There are at least, based on some estimates, we have 130,000 psychiatric mental health nurses in our nation. About 109 of them are registered nurses, and 26,000 are advanced practice psychiatric nurses. That's a good question in terms of, it's hard to answer the why they restrict it. I think there are various reasons, but perhaps one of the main reasons is because they may not fully understand what psychiatric mental health nurses are capable of doing, and to what extent we have been trained to address the nation's crisis in mental health. So I think we have these states that have varying levels of restrictions that have been placed on our ability to work and to deliver care to the full scope of our training and our education. Again, the reasons for this vary by states. It's hard to address it, but looking at things from a national level, because there are these restrictions, it does limit our ability as psychiatric mental health nurses to provide care to the people who really need it. So taking away these limitations would go a long way in addressing the issues that we have in our nation's mental health crisis. One is that policymakers need to understand that mental health challenges are treatable. These are treatable conditions, and psychiatric mental health nurses are trained, along with other healthcare providers that deliver mental and behavioral health. We are trained to treat these conditions. So if people can recognize, policymakers can take away some of the stigma associated with mental health and also mental health seeking behaviors, and recognize that there is a workforce that is available and trained to address these issues, and support this workforce, especially psychiatric mental health nurses, to practice to the full scope of their education and training, and provide resources for them to get trained and for other individuals who would like to join this workforce, and to take away some of the barriers related to insurances and ways to cover mental and behavioral health treatment, then I think we can effectively address our nation's crisis. Yes, I think two key messages. One is that when we consider psychiatric mental health challenges, it's so important to recognize that they're treatable. I mentioned some statistics of what the nation is facing, but it's only statistics until it becomes personal. I have several patients, clients, and also family members who have gone through the challenges of accessing psychiatric mental health care. When we need the care the most, we want to get rid of any barriers whatsoever that can limit our ability to receive the care. So access is key, and access requires understanding that there are mental health professionals who are available, trained, and can treat these conditions. The second aspect I would like our audience to understand is that psychiatric mental health nurses are the second largest psychiatric mental health workforce in our nation. And so they are available, and they leverage a lot of technologies like telemedicine. They leverage other aspects of ways to ensure that we can reach the people who really need to be reached in terms of mental health. So the support of understanding what psychiatric mental health nurses are and what they do is key in order to also address our nation's mental health crisis.